Welcome to Value-Based Care Insights, brought to you by Lumina Health Partners, a national healthcare consulting firm focused on improving the strategic, financial, and operational performance of provider organizations. On this program, we will explore trends and share valuable insights on how health systems and medical groups can optimize their performance to meet the demands of this increasingly complex healthcare environment and shift to transform the delivery of care. Value-Based Care Insights is hosted by Daniel Marino, Managing Partner of Lumina Health Partners. Daniel has been in the industry for over 3 decades and specializes in shaping strategic initiatives for organizations in areas such as population health, clinical integration, physician alignment, information technology, and data analytics. For additional insights, visit luminahp.com and sign up for our newsletter. Dan, over to you.
Welcome to Value-Based Care Insights. I am your host, Daniel Marino. In today's episode, we're going to spend a little bit more time talking about the HIMSS conference that occurred a couple weeks back. If you recall, in the last episode, I had 2 great interviews with Dr. Alan Young and Steve Overman, where we talked about their specific technology that they had displayed at the HIMSS conference. Well, I'm really pleased today to have a fellow podcast host with me. He is president of Accountable Care Health and host of his own show, PopHealth Week, Fred Goldstein. Fred, welcome.
It's a pleasure to be here, Dan. Looking forward to today's discussion. Thanks.
Brad, it was interesting couple of days at the HIMSS conference. What was your impression?
I thought it was maybe a little more subdued than usual, but still a very big crowd, etc. I thought the focus areas were interesting, obviously with AI and digital health, and digital tech. Workforce I didn't spend a lot of time on, and obviously cybersecurity is a big issue. But really, where do we get to these things actually impacting the patient? That's sort of where I was looking at the digital tech and AI, and are we using it to improve outcomes and really move into value-based care? And I'm not sure, what were your thoughts on that from a value-based care perspective?
Well, I agree with you. I think the artificial intelligence vendors and all the technology, as well as the digital technology, was quite impressive. I didn't see as much around specifics to value-based care. I was hoping there was going to be a little bit more solutions, maybe around care management, maybe around some of the performance analytics. And it was interesting because this isn't a major focus of HIMSS. And I did have an opportunity to actually talk to Hal Wolf, and I asked him that question, specifically, how was HIMSS going to be positioned to support value-based care in the future? Let's take a few minutes and listen to his response.
Yeah, I mean, we've always been a fan of value-based care. And I think that what value-based care's end state and goal is an efficient healthcare ecosystem that tries very hard to treat individual patients with the best outcomes for the least amount, right? And that's really what sits behind it. Now, that's an old expression.
Sure.
That actually came out of Intermountain. You know,
right.
Intermountain, you know this, right?
Very well,
okay,
yes.
So you know the history.
Yep.
And so that I always, when I heard that mantra from Intermountain 20x years ago, I personally adopted it, and I thought it was a fantastic statement.
Mm-hmm.
And I think that's what really is behind value-based care. We've seen pieces of it, and that's what Medicare Advantage is.
Sure,
right?
yeah.
So that's an expression of it. Globally, we're hearing the same thing. So it's not just a U.S. thing. It's a cultural issue. We're going to see how it comes together.
Mm-hmm.
But I don't think what we're trying to do is recognize and say, this is the best way to squeeze the highest level of efficiency, access, and quality through the use of these digital areas. There are other things that will contribute to that that's not in our space, but when it gets into digital health transformation, that's where we sit.
An interesting response, Fred. I'm really hopeful that HIMSS does focus a little bit more attention on value-based care performance. But let's dive into some of the specifics, particularly around artificial intelligence. Were there a couple of things that really caught your eye as you were talking to any of the vendors?
Yeah, I think the key things we're seeing, and this has been talked about at a number of last couple of years, really, is this use of AI to solve various issues that are not directly patient care issues, but are workflow issues and things like that. Employees going out and gathering this data or these data and then bringing them in and adjusting them. And I think we're seeing some great progress in those areas. So it was really interesting to see that. The clinical side obviously is touchy, and it'll take a while for some of those types of technologies to be accepted by physicians and other clinicians as augmented intelligence versus artificial intelligence. I think that's the key as we begin talking about those areas. And you, how did you see the whole AI spectrum there?
I saw a lot more advancement on the business and the administrative side of artificial intelligence. I think to your point, we're just starting to figure out what the clinical impact's going to be of artificial intelligence. But the administrative side or the business side related to managing, say, the revenue cycle or pre-authorizations, those type of things, I thought there was quite a bit of advancement. One thing that caught my eye, though, was the role of agents within artificial intelligence and how they would interact with patients.
Yeah, I think the issue of using agents is really fascinating, and I think this also gets back to a few years ago. I'd interviewed an individual who was a CIO at Cleveland Clinic at the time, who made the comment, "I think we may lose 30% of our workforce at the hospital because it really is taking some of those workloads by using these agents off of people and allowing them to maybe at the very end take a look at it and validate it. But really, whether it's interacting with a patient, where I've seen these call centers show 14 to 20% more efficiency by using AI, to things like you talked about, using it for prior authorization or document scanning, et cetera.
Yeah, I agree with you. There was one vendor that I had an opportunity to do a demo with, and they started to incorporate agents within their care management services, and they just started to scratch the surface on what potentially this can do. And I thought some of this was a little bit more of kind of a visionary technology, because they were talking about how the agents could work with remote patient monitoring, interact with the physicians, and almost be that virtual care manager. I thought it was really interesting on how they would grab the data, incorporate into an agent, and really use that as sort of a first line care manager on being able to drive some of those results.
Yeah, absolutely. And I think as we had discussed earlier, I did a show for Consensus with Mohana Nagda, who is at Athena Health, and we talked about the use of AI for faxing, ingesting that data, putting it into the EHR, and then actually using AI to then push it back out to the appropriate physician for referrals, et cetera. And I really think you're going to see these workflow issues solved with some of these AI tools.
Yeah, I agree with you. And Athena had a pretty big booth there. They were doing quite a bit of demonstrations on a lot of their technology. The other one that I had an opportunity to talk about, another EHR vendor, is eClinicalWorks. And eClinicalWorks has spent quite a bit of time working through a lot of their agents, even incorporating some bots that would allow them to provide some interaction there. Fred, I had an opportunity to interview the vice president of sales for eClinicalWorks. His name is Samir Bhatt. I asked Samir, or he goes by Sam, what are some of the new and interesting things that he's seeing related to technology that he's incorporating into eClinicalWorks that would really drive some performance, not only for the providers, but also for the patients. An interesting conversation. Let's listen to this for a few minutes. I am here with Sam Bhatt. He is Vice President of Sales and Marketing for eClinicalWorks, someone I know for quite some time. Sam, great to see you.
Great to see you, Dan. It's always pleasure talking to you.
Well, thank you. Well, the conference has been fantastic. And I'll tell you, there's such a great momentum push for artificial intelligence.
Yeah.
And knowing the experience and my previous experience with eClinicalWorks, you all are always at the top of the technology game. So what are some of the things that you're doing with artificial intelligence integrating it into your solution?
A lot of things. We see artificial intelligence as an integral part of the entire electronic health record and revenue cycle management. We offer artificial intelligence in two flavors. One is called as an assistant, AI as an assistant that can help in the front office, in the mid office, in the back office. But then there is this new concept called AI agents coming into play that can do autonomously multiple things for you, both in the front and back office. It may not apply for clinical workflows yet because
But for the business workflows, I think it's got to be incredible.
Absolutely.
Everybody's looking at trying to get more efficient. Everybody's
Yes.
looking at trying to do more with less and bring down costs. I would think the agent has just got to have some incredible outcomes to it.
I mean, we just introduced this whole agentic revenue cycle management, where essentially you are able to do 90% of the tasks that you do today through agentic workflow. I mean, I'll give you some examples. Think about sending appeals to payers when you have the insurance denials. It's a nightmare sometimes.
Oh, yeah.
An AI agent can actually pick up what the denial is, and based on that, it'll assimilate all the information for you, create a packet, submit that for you, and to an extent where the agent will start communicating with the insurance on the other side,
Wow.
because insurance companies on the other side are implementing agents on their side.
Yes,
The
they
only
are.
way to fight that battle is you got to have
It's
an
an agent
intelligent.
to an agent, right?
Absolutely right.
Well, I'll tell you, for independent practices, and I know that's a sweet spot of eClinicalWorks, that is so important, right? It's all
Absolutely.
around efficiencies, and it's all about maximizing your revenue potential.
Exactly. I'll give you another example where you still receive faxes coming into these small practices, and they don't have time to look at those documents. And an AI agent can look at the information that has come in and create a quick summary for you. And think about an EOB coming into your office as a printed form. I mean, that still happens.
Still happens.
10% of the payments are still coming as printed EOBs,
Yeah.
but they take 90% of your staff time to post the payment.
Yeah. So
Now-
can you imagine the productivity that once this really becomes part of our standard operating approach? I mean,
Absolutely.
the productivity is going to be
I
unbelievable.
mean, we are releasing these agents as part of our update this month, and we'll be able to see the benefit of that this calendar year, not future.
Well, that is really exciting. And as I mentioned, I mean, eClinicalWorks has always been on the cutting edge of technology. It's always been something that I've been extremely impressed with your organization and with your leaders. So I wish you a lot of luck here. How's the conference going for you?
Conference is going really great, and we are seeing a lot of momentum, and a lot of organizations looking for a change, not just for change, just because they want to change, but they want better efficiency and increase their productivity, cut down the physician burnout.
Yeah, and cutting edge technology, and that's what you guys have. so.
Absolutely.
Well, thanks again, Sam. I really appreciate your time.
Thank you, Dan.
Interesting comments by Sam. Love some of his thoughts on where artificial intelligence is going to go, and in particular, some of the activities around the agent. Digital technology, Fred, was also a big focus of HIMSS, and of course, this was one of the four areas, pillars, if you will, that HIMSS was really focused on. Was there something related to digital technology that really caught your eye?
Yeah, I think we're seeing this incredible growth in the potential. Now, how much of it's actually being used in the market is less of this remote patient monitoring. And I think back to when I started my disease management and care management company, typically someone would see a doctor once, twice, maybe a Medicare person might see him 8 times a year. And that's a blip. It's one little measuring point in this giant data set of what the individual's life is like. And by adding a care manager, somebody who called or talked to him, you suddenly increase that data set. Now, with remote patient monitoring, we can really begin to understand the natural history of disease of an individual's personalized condition and how it's impacting them. And I think remote patient monitoring has some incredible potential, especially when linked up with AI, because the data sets will be just gigantic.
Yeah, I agree with you. There was another vendor that I was had a chance to talk to, and they were focused on remote patient monitoring and really using that to help create some efficiencies in transitions of care, going from patients who were in the hospital upon the discharge and care in the home. And it was fascinating for me to see how they were integrating remote patient monitoring based on the individual disease condition. So those that had, say, cardiovascular issues or even diabetes or what have you. But the interesting thing about that was how it integrated all of the data into a prioritization of information that was able to give it to the care managers. I thought that was really fascinating. That could potentially be a real game changer as to how we manage care post discharge or really care in the home.
Yeah, and as you mentioned, that area of transition is a huge drop point where you see real issues show up because the transition doesn't go smoothly. So if you have a system that can be monitoring that and then say in effect, hey, here's a here's a warning, we've got this going on that we need to address now, that's going to be a huge improvement in outcomes, cost, etc.
Yeah, and the part that I thought was interesting on this was it allows through this advancement of digital technology, it allows us to get in front of some of these disease conditions and to better understand some of these disease conditions. So, another area that I found that was really interesting was how some of these technology vendors are helping to address issues of cancer and different cancers. So we can begin to not only use AI to identify diagnoses, but we're also then using digital technology to create more advanced therapies and working with the patients. I thought that was really fascinating. Was there anything out there that really caught your eye related to that?
I think the cancer area is really interesting. Obviously, there have been incredible advancements with digital tech applied to image analysis. And when you can get down the pixel level, you can really begin to understand what's going on and identify things that may not show up to our normal eyes when we look at it. And so I think that that's going to be an area where we'll see some rapid integration of new technologies. Obviously, the radiologist will still need to be involved, but it could take a huge workload off of those individuals so they can become more efficient as well.
Well, absolutely. And it helps to as we're starting to think about the technology, I'm working through this with patients. Not only is it going to help the cost, but I could really see us thinking about having more personalized care and therapies that are really going to drive better outcomes for the patients and frankly make the patients more comfortable as they're going through their treatments.
Yeah, I think you're right on target with that. Whether it's the personalization of the messaging, because obviously I may react to some funny comment when I'm trying to lose weight and stand on the scale and it says, "What happened to you, Fred?" Where somebody else may need a different persona that's more gentle or something that helps them get motivated. So I think you can use it in that area, obviously in the diagnosis area, in looking at new treatment approaches, developing. So there's incredible potential. How and when we get there, I think is the big question, but we're beginning to see some progress. Absolutely.
Yeah, I agree. So when I was talking to one of the vendors, I asked the question to him about, how is this being received by physicians? And many of them, this one particular gentleman came back and said, that's one of their biggest challenges because physicians have their approach on treating patients. They have their methodology that they incorporate into their care models, and to have them integrate that technology into the way that they practice is a bit of a challenge. It's almost relearning how to practice medicine. I thought that was really fascinating. Did that come across at all as you were starting to have your conversations as to the integration of that technology in the care plans?
Yeah, I think there's definitely hesitancy, and some of it is based upon reality. When we build these AI models and don't have a broad enough data set, as we've seen in the past, we come up with issues where the model isn't correct. And so
Yeah.
there needs to be the hesitancy, there needs to be standards set. The physicians need to be comfortable with it, the patients need to be comfortable with it. And I think then including them as an augmented intelligence versus just artificial intelligence, I think is going to be the key to solving that problem.
So I had an opportunity to sit down with a gentleman, Dr. Alan Young. He is a physician, client executive with Point B Solutions. And I asked him just that. I asked him what that integration was going to be or how it was going with physicians and how they were using that and incorporating it into their practice, into the way that they deliver care. It was an interesting response. Let's listen to that for a few minutes.
Yeah, thanks for having me, Dan, and appreciate the time. One thing I've noticed is the growing trend and talk around AI agents. And the way agents are defined is that artificial intelligence powered workers that go and complete tasks on their own autonomously and then kind of bring the results or insights back. And what's exciting is to think about not just the agents and what the work they're doing, but the oversight of an agent representative or agent coordination. So you have multiple agents doing multiple things, and then you have that step in between where someone or AI will actually coordinate all of these different activities and hopefully bring the appropriate insights, recommendations, next steps, or even new content to clinicians, right? As a physician, it'd be great if a number of agent AIs can go into a patient's record and come up with a number of different recommendations that kind of don't necessarily interrelate with each other, but then have someone then oversee all of that and provide a meaningful recommendation or plan with context, and also provide some of the shortcomings and things where they saw there wasn't enough information, or areas where the clinician definitely needs to lean in more.
Well, and I think the agents, to your point, are definitely going to be that mechanism that's going to allow us to really not just operationalize, but really realize the benefits of AI pretty quick with patients. Yeah. Well, thank you for your time. I appreciate it. Enjoy the rest of the conference.
Thank you.
Great response by Dr. Young. Really appreciate that. Fred, this was a great conversation. I want to get your thoughts. You've been going to HIMSS for a number of years. For many of our listeners who've not gone to HIMSS, I'd highly recommend it. It's a wonderful experience. As you reflect on this conference and past conferences, Fred, where do you feel like the greatest impact is for providers or for participants to either attend a conference like HIMSS or just participate in HIMSS?
Well, I think HIMSS obviously is overwhelming. And we talked about this before we recorded the show. And you had an incredible idea that I had never really thought about how physicians should approach this. And you've been using it apparently for a couple of years. So I'd love to hear that again.
Yeah. So given the fact that, there's 1,000+ vendors there, 28,000 participants, it's hard to navigate through the different vendor communities that are there. Oftentimes, what we've done on behalf of clients is if clients wanted to see something specific, say they were looking at analytics or they were looking at, specific types of technology, we would actually reach out on behalf of the clients and pre-schedule a lot of these meetings. It was a great way to have a very focused approach with the conferences. And we found that was really a great way to approach it, because it is quite large. And to your point, it is a little overwhelming if you're just going to show up there on day one.
Absolutely. It's you've got to sort of quickly map out the booths, which rows you want to hit, and then kind of that's what I did. And I just worked from the low numbers to the high numbers and said, oh, that one's in this row. I got to go left. I got to go right. And I had some really fascinating conversations. I got a chance to interview some folks. So it was really a great conference overall.
Yeah, I agree. Where do you think HIMSS is going to go in the future?
Well, it looks like they keep getting sort of more tech oriented, and as if, and this worries me always, that tech is the solution. Well, tech is part of the solution. At the end of the day, we still need people. People do respond better to people typically. So I think when it gets down to value-based care, as you focus on, that's still going to need a combination. And I don't know that we necessarily just solve it with tech. And sometimes I wonder if HIMSS goes a little bit too far in that direction.
Yeah, I agree with you. I've said for a long time, the technology is important, but it really comes down to the people, process, and how you use that technology. I think that's really key. It'll be interesting to see where things go. They clearly make a big impact in the whole technology world, and certainly the integration with healthcare. Well, Fred, I want to thank you for coming on. I love having a fellow podcast host, and again, another big shout out to your show, PopHealth Week. It's a great program. I've listened to it many, many times.
Well, fantastic. It's been my pleasure. Thanks for having me on.
And to you, our listeners, I want to thank you for tuning in. Until our next insight, I am Daniel Marino, bringing you 30 minutes of value to your day.
Are you at a crossroad with value-based care? Do you need to chart a future strategy or improve your organizational performance? Visit us at luminahp.com to learn more about our consulting services and leadership development programs. Also, you can sign up for our newsletter on our website and follow us on Twitter and LinkedIn. For more information about value-based care insights, visit the program's page on healthcareradionow.com or luminahp.com. Join the conversation using our hashtag VBC Insights. We are Lumina Health Partners. Thank you for joining us today. Until the next value-based care insight, stay well.